A neurotic person not only behaves neurotically, makes wrong choices, thinks wrongly, but also expresses their pain neurotically, cries neurotically. One would expect that when a neurotic person somehow connects with their pain, they would express it in the right way and gradually free themselves from it. Probably even Janov himself, Artur Janov, initially thought so. He believed in the motto, pain is the name of the game. That is, the goal is to throw the patient into pain, into suffering, and the rest will sort itself out. However, in the last years of his life, Janov became aware that every action, that is, neurotic expression of emotions, is not just an occasional problem in therapy, but the biggest and most widespread problem in feeling-oriented therapy, such as primal therapy. A neurotic person, as my therapeutic experience has shown, unconsciously tries to express their pain in a neurotic, self-destructive way, both for themselves and for others. For example, if the trigger for tears is criticism from the boss at work, some colleagues have already been fired. The neurotic person first becomes deeply worried. If a family member approaches and hugs them, reassuring them that everything will probably be fine in the end, the neurotic person does not receive that tenderness, does not absorb it, and does not find support in it. Instead, that hug sets off a spiral of despair and blame. Why is this happening to me? What have I done to God? It always finds what I fear the most. How will I endure all this? I have no support in anything or anyone, while their whole family, husband, children, grandchildren, may be around them. Indeed, a neurotic person may have parents, relatives, friends, a house, an apartment, a husband, children, a car, but they will cry and say they have no support in life. Their crying, of course, sounds inauthentic, forced, but they continue and then they go on the attack. They accuse family members of not understanding them, despite everyone showing sincere sadness for what has happened to them. That nobody loves them, that everyone only thinks of themselves, that nobody cares about them, and that nobody will help them if they lose their job, even though both their husband and close relatives assure them not to worry about money, that it won't be a problem. Nothing helps. The neurotic person is on the rampage and wipes out everything in front of them. They cry, tear themselves apart, accuse, envy others who have a stable job and a higher salary, devaluing everything that they have and everyone around them. This, of course, hurts the people around them because they thought she would see in them those supports and that her presence and empathy would ease her pain. However, no. Their presence and attempts to hug and comfort her increasingly irritate the neurotic person, and she falls into greater despair. It's very difficult to bring a neurotic person back to the track of healthy expression of concern, worry, pain, or sadness. In extreme cases, it is impossible. Fortunately, there are people and clients who know how to accept help and words of compassion, cry sincerely, do not blame anyone, and are grateful for the support and help they receive. For them, crying brings relief, and working with them is easy. Each session contributes even more to their understanding of the process of releasing pain from the soul, and they feel better and better. Of course, there are people and clients who are somewhere between those two extremes, and there are most of them struggling with their neurosis and their pain. So one session takes them 2 steps forward and another brings them back a step. Their experience of pain in therapy is a mixture of authentic and neurotic experience of pain, a little of one, a little of the other. So we can freely say that clients can be divided into how well they use their natural ability to cry and express pain, how quickly they learn to use that ability more and more, all in the goal of liberating themselves from neurosis. The role of the emotional therapist is crucial. They help clients stay in the right course, not deviate from the healthy path, correct their neurotic tendencies in experiencing pain. In very neurotic individuals and clients, where the wrong and self-destructive way of expressing pain is deeply ingrained, probably since childhood, any help has little chance of success. On the other hand, in those who have preserved the ability to cry with tears and expel their pain and suffering, minimal help is needed. They almost do their therapy on their own. Therefore, the therapist's role is greatest with clients who are somewhere in between. Thank you.